歡迎大家。
Welcome to today's press briefing. We have with us from the CHP Center for Health Protection, Principal Health and Medical and Health Officer, Dr. Albert Out, and from the HA Chief Manager, Dr. Larry Lee. We'll first hear from Dr. Au. Good afternoon, everyone. I would like to report the cases we have received yesterday in relation to COVID-19. Well, for PCR positive cases, we have 3,884 cases. Cases number 7154692 to 7195352. Of these 3,884 cases, we have 610 cases confirmed by the HA, 293 by Public Health Laboratory Service, and the remaining 2,981 were done by private laboratories. In relation to RAT positive cases, we had 4,957 positive cases. So altogether, yesterday, there were 8,841 positive cases. The accumulated number in the fifth wave is 1,708,392 of them. That includes 411,000 or so RAT cases. In the additional new cases, there were 6 imported cases. The remaining are local cases. Yesterday, the Public Health Laboratory Service has conducted genome sequencing for 1,264 samples. We have not identified any positive result towards L452R. 1,234 cases are negative to L452R, which means they are Omicron cases. 30 samples carried insufficient viral load. In terms of care homes, yesterday there was no new cases in care homes that have not seen any outbreak or confirmed cases. So far, 783 care homes for the elderly have seen confirmed cases or have suffered from an outbreak. 41 of them have confirmed cases, which account for about 5% of the total number of cases, involving 805 residents and 147 staff members. In relation to care homes for the disabled, so far in the fifth wave, there are 284 care homes for the disabled with confirmed cases, of which 19 of them were new homes with cases in the past 2 weeks. That accounts for about 5.7% of all such homes in Hong Kong. 232 residents and 126 staff members. In terms of deaths regarding care homes, there are altogether 3,786 cases. For the overall cases of deaths in the fifth wave, we have 6,888 deaths, an additional 139 cases. So the latest death rate is 0.62%. The age is 11 months to 112 years. Median age is still 86. There are 8 pediatric patients under the age of 18. For those between the age of 18 and 59, there are 269 deaths, which accounts for 3.9% of the total number of deaths. The remaining 6,602 cases involve those above the age of 60, which accounts for 95.8% of the total, of which 4,881 cases involve those above the age of 80, which accounts for 70.9%. In terms of new cases, 5 of them were picked up by a forensic pathology service. They were death cases on the 16th of March, 4 males, 1 female, aged between 17 and 92. They have not been vaccinated and they are all critically ill. In terms of vaccination rate of the number of deaths, we identified that 88.6% of the deaths have received none or only one dose. And for those above the age of 80, it is as high as 90.7% of the deaths that have received none or only one dose. For comparison, as a whole, for those who have received none or only one dose, the death rate currently is 1.84%, compared to those who received at least 2 doses, which is 0.1%. There is a difference of 18 times. For those above the age of 80, for those who've received none or only one dose, the death rate is 11.8%. Compared to those who received at least 2 doses, death rate is 3.1%. There is a 3.8 times difference. That's my report. We'll now hear from the hospital authority. There are 10,799 patients staying in public hospitals and the North Lantau Hospital, Hong Kong Infection Control Center, AWESS, as well as Infectious Disease Center. 51 patients were in a critical condition. 25 of them have not received any vaccination. 60 of them in a serious condition. Altogether, 103 patients are staying in ICU. As at midnight, in the previous 24 hours, 114 patients passed away. They are 65 males and 49 female, aged between 3 and 106 years old. 52 of them comes from care homes, 76 with no vaccination, 27 with 2 doses, 11 with 1 dose. 106 of them are above the age of 65. There are 5 young cases of deaths that I would like to elaborate. First is the 39-year-old male, bedridden, suffering from chronic illness and fed through the tube, with the background of epilepsy. He's a resident staying in a residential care home. He had a fever, and on the 10th of March, he was tested positive. His condition deteriorated, and on the 25th, he passed away. The other one is a 52-year-old female. Terminal cancer case. On the 22nd of March, in an outpatient follow-up, her condition deteriorated with edema in the abdomen, as well as another condition relating to the bile. At the beginning of March, her RAT was positive. We tested her and found that the CT value was over 30, and it's a positive case. She was sent to oncology, and proper treatment were carried out to alleviate her condition. Her condition continued to decline. Because of bile condition, on the 25th of March, she passed away. The third case is a 56-year-old female with a thyroid problem. On the 25th of March, at around midnight, she was sent to United Christian Hospital A&E department, suffering from high temperature, shortness of breath, and signs of pneumonia. She was admitted, and her condition deteriorated rapidly. She was resuscitated, intubated in the ward. At 8:52 in the morning, she passed away. The next one is a 59-year-old female, chronically ill, suffering from heart diseases as well as some pulmonary illnesses. On the 23rd of March, in the afternoon, she was sent to the A&E department of Queen Elizabeth Hospital. Her blood pressure dropped, heart rate increases, pain in the right upper abdomen, and dark-colored urine. We've conducted tests and found that there was inflammation in her bile. We conducted cholecystectomy, which is a perforation procedure. She stayed in ICU. Her condition continued to deteriorate. On the 25th, at around 4 a.m., she passed away.
And finally, the 3-year-old girl case. She has an underlying condition with a brain condition, and she was hospitalized for a long time. She went to the Prince of Wales AD department, and on the afternoon of 18th of March, she had a fever and a seizure, a cramp, and she tested positive for RHE, and she was sent to the children ICU. She continued to suffer cramps, and we detected pneumonia. We immediately provided treatment at the basic level and also prescribed remdesivir. Her condition slowly deteriorated, and her heartbeat slowed down, and her blood oxygen level kept dropping. And on 25th of March afternoon, she passed away. And from 25th and 5th to 24th, there are 21 unannounced deaths, including 10 male and 11 female, aged between 39 to 105. Over the past year, we have 1,447 patients discharged. We have 10 patients positive on admission screening and 10 patients classified as close contacts. For the employees, we have 2,667 staff positive, and 17,018 staff returned to their post. The case at the Ratunji Hospital, which I wish to mention, recently reviewed some death cases. For the 14th of March case, the one death case that we counted double. After communicating with the Department of Health and verified the figure, and that's the end of our report. We'll now open the floor to questions, and please introduce the media represent. On the front row. Now news. Today, confirmed cases at around 8,000, around a 4-digit level. Does that mean that we have passed the peak into the 5th wave? And for the relaxation of social distancing on 21st of April, any chance of advancing the date? For the elderly isolation facility, reported to have low usage. Can the HA tell us what's the criteria for transferring patients? And how many patients have you transferred to the isolation facility? And introducing the AstraZeneca drug, since it's the antibiotic, who will be issued this drug? And would they have the same effect like vaccination? And for the immunocompromised individuals, when prescribed AstraZeneca, does that mean they don't need to get vaccinated? On the first question on the epidemic situation, there are about 9,000 cases a day. Compared to yesterday, there is a slight drop. And this level compared to last week of around 12,000 or 14,000, we noticed there is a drop. While the daily caseloads will have fluctuations at around 1,000 or so. Therefore, just reading 1 or 2 days of figures, we can't really tell that there's a downward trend. One thing for sure, though, we're quite confident that the peak might have passed compared to early March with daily caseload at around 70,000. Plus, we noticed there's quite a drop. We need to monitor the situation for a few more days to see that we mean to keep the caseload at such levels and stabilize and continue to trend downwards. Well, this case number seems to have dropped substantially. However, at this level of close to 10,000 is still very high. I hope the public should stay vigilant. They should not mistook that the epidemic is under control. While the 10,000 cases per day in Hong Kong is still a very high level, and I hope that the public can keep up with the social distancing measures. And despite some improvement, they should not take fewer tests. If they've been exposed to friends or relative or colleagues being infected, or they are showing symptoms, they should get tested as soon as possible in order to know whether they are affected. For your second question, I hand over to Dr. Lee. For the community isolation facility, you're referring to the holding center rather, for the elderly. I can't provide an accurate figure on the number of residents there. So far, well, if a patient in a stable condition but still tested positive, we will transfer them to the holding centers. The social welfare department will engage private contractors and caring team to care for the patients. In some cases, though the holding center may not be capable of taking care of them, they'll be transferred to AWE treatment center. And for the Paxlovid, well, as the antiviral drug, we hope that it could be prescribed as soon as possible, as it can effectively reduce the death rate and complications. I don't think it's related to the vaccine. Well, the vaccine is the most important and most effective way to prevent infections. For the other medications, our experts will look into it. We will consider introducing different medications. On the right, cable news. And some healthcare staff union claimed that the HA staff allowances only covered to the AE department and the first and second tier COVID beds, and yet the general wards are not eligible. And neither are they eligible to use the high-level PPE. Are you not giving standard treatment? Would you consider extending the allowance to them? The CE agrees that the cases load would not drop to a sharing level shortly. And now we're only less than a month away from the 21st of April. Subject to the trend, can we relax the measures confidently? For the 3-year-old girl, what's your preliminary take on the relationship with the COVID? Let me first talk about the 3-year-old girl case. And she had a fever and a seizure, may have to do with her brain condition as well as the COVID. And so whether this case relates to the COVID, well, we need to refer to the coroners, and I am not able to provide an answer for now. As for the healthcare staff, in terms of the allowance, well, it's subject to different circumstances. For example, the nature of the wards and the job duties or increase in workload due to COVID. In our review, we not only look at whether they will be exposed to COVID patients, we also need to consider whether the workload will increase due to the epidemic or let a substantial increase as brought by the COVID patients. We will be discussing from time to time and formulate them accordingly. I think that we are quite fair, and for the different staff who make their contribution, we'll definitely recognize their effort. That's all for me. For the social distancing measures, like the CE said, currently we still need to maintain all these measures. The current caseload is still at a rather high level, even though there are some positive signs that the cases have become stabilized. However, we still need to maintain all these measures to prevent any rebound. And for the next few weeks will be critical. The CHP will monitor the latest situation daily. Well, with all these social distancing measures and testing and all the public health initiatives, and hopefully the caseload will reduce the next few weeks and continue to trend downward. Well, the public should stay highly vigilant, otherwise there will be a rebound. And once again, appeal to the public. For those who are yet to be vaccinated, they should make use of this time to get vaccinated as soon as possible to add to the overall protection.
In relation to the various social distancing measures, I believe that the government will make adjustments in accordance with the latest assessment. Lady at the front. I'm from TVB. First, I'd like to ask, just now, a fellow reporter asked about general ward and the staff working there. They have insufficient equipment. They only use not ordinary surgical masks. Well, they receive COVID patients. In terms of their protective gear, would you consider enhancing the level of protection for them? In relation to the utilization of holding centers, the government has recruited 630 care staff members from the mainland. Over half of them have been sent to work at these holding centers. With such a low usage rate, is there wastage? Would you consider deploying the manpower and resources on other fronts to fight the epidemic? I will first answer the second question. In relation to isolation centers, the usage rate, there is still capacity before it's full. Well, in any event, I do think that with the number of cases decreasing, it's good news. In relation to the change of a discharge criteria, we will wait for elderly people to turn negative before they are sent back. But if they are in a stable condition and still positive, I think it is appropriate to send them to these facilities for isolation. They will be cared for until their result is negative before they are sent back to care homes. When you're talking about wards, well, at hospitals, we have guidelines in relation to personal protective equipment, PPEs, as well as infection control measures. We will provide appropriate PPE as well as training to the work involved. Our staff members may make use of different levels of PPEs in accordance with the work they will take up.
The South China Morning Post. So, well, we can see as well as Carrie Lam, the chief executive, said this morning that the infection dropped, but the drop in death toll is in a slower pace. So, can we ask about what's the reason behind, and also can we ask about your opinion about letting private doctors to prescribe the oral COVID-19 drugs? Thank you.
I think I'll answer the oral antiviral drug first. Okay. For the oral antiviral drugs, there are two kinds that are available in Hong Kong, and actually we have been prescribing these medications throughout different channels. The output will include the designated clinic, the CTF, CIF, and also the hospital. And whereas the private sector, we have allocated a certain amount of the oral anti-drugs to the private hospital. And regarding the private doctor, we will facilitate, but that will be involve some public health procedures, and actually we are working with the government relevant department to work it out.
For the epidemic situations, we start to see early sign of stabilization of the epidemic situation, but however, the number of cases still remain at a high level. I have to say that about 10,000 cases per day, as compared with several weeks ago, the number of cases has significantly decreased to a lower level. For the death cases, we are seeing a delay in the decrease in the number of fatal cases. The reason is due to the fact that the death cases recorded in the past few weeks, they are not actually infected very recently. There is a time lag between infection of the patients, and after that, the patient might deteriorate and may succumb in about 1 to 2 weeks' time. So there will be delay in recording of between the time of infection and the time of death. So the fatal cases we recorded in the past 1 week, they actually most of them got the infections earlier, about two to 3 weeks earlier. So we are still seeing a high number of fatal cases recently.
下一題，後邊嗰位紅色衫個。
The person in red at the back. I'm from Phoenix TV. First, I'd like to ask about the relaunching of CTN compulsory testing notices. Well, how effective is it to cut transmission chain? If members of the public are to remain alert, then is it really true that the epidemic situation is stabilizing? To what extent should it drop before you think it's an appropriate time to launch the compulsory universal testing? In relation to CTNs, the compulsory testing notices, it is effective in identifying cases. For some people living in high-risk buildings, they may not have any symptoms. We select buildings to put under the CTNs. They are buildings with a large number of cases in the past 7 days, and these buildings have never been put under CTNs. So some people may not be aware of this fact. By issuing CTNs, we will alert residents to get tested, and if they are positive, then they will be isolated and their family members will be quarantined. It is effective in cutting transmission chain. In relation to the trend of the epidemic, we'll have to look at different indicators. Say, for example, every day the number of cases from PCR as well as RAT, that's the first indicator. Secondly, we have to look at the trend, whether it's a continuous drop or whether it's plateaued. We also have to refer to other monitoring indicators, say, for example, the samples collected under sewage surveillance program, whether there are still numerous locations with positive samples. In addition to that, we will look at the number of positive cases or its percentage under restrictions and testing declarations. Through these indicators, we will have a better picture of the trend of the epidemic. It's very difficult to tell how it will pan out. The most important thing is for all of us to abide by the social distancing measures. And if you manifest any symptoms, do a test. Hopefully, your case will be picked up early in order to avoid spreading it to other people. The one towards the right. I'm from News. I have 2 questions. First, the Department of Health has spoken to pharmaceutical companies researching on new vaccines. The new one may come in September. Well, if that is the case, then it is rumored that there may be the 4th jab. Do you have any plans for the 4th jab for people who have received 3 doses? Well, for those suffering from asthma, if they have received the vaccination, the situation or their condition deteriorated. So it's, well, doctors say that they should first treat their eczema before having an assessment done on fitness to vaccination. But a lot of people don't get medical certificate to exempt them from vaccination. Well, how many people have got the exemption, and what are the main conditions involved?
On the vaccines, the government has been monitoring the latest development to see any new vaccines for procurement. For the scientific data related to vaccines, the government expert committee and the CHP Joint Scientific Committee regularly review the effectiveness of vaccine on stemming up COVID and issuing the most suitable recommendations. Besides the immunocompromised individuals, for the general public, we hope that they can get 3 doses as soon as possible. If there are any latest development, the committee will continue to review whether we should introduce the 4th shot. And for the safety of the vaccines, currently BNT and the Sinovac vaccines are rolled out in many places around the world, and we have lots and lots of people vaccinated. And for the safety surveillance has proven that both vaccines are very safe. Besides the contraindications, for example, allergy to vaccines or after doctor assessment unsuitable to be vaccinated, most members of the public are suitable to get vaccinated. Speaker, not a mic. I do not have such data at hand. Next question. The lady at the far back. Ming Pao Daily News. First, I would like to ask about the residential homes. Just now we heard from Dr. Al that the mortality rate of the residential homes of over 3,000 plus, compared to the figure yesterday, there's an increase of 101. And yet, from Dr. Lee, that there are just 52 death cases. And how can you explain the discrepancy? Are these cases from the mortuary, or they died after released into the residential homes? And during the 5th wave, the RCHD, the RCHEs, how many residents were infected? What are their proportions? And what are their respective mortality? And second question, on the 3-year-old girl case, before she was admitted, did her parents know that she was infected? Was there any delay in admission? If discovered earlier, can she be prescribed any oral medications, or she may not be suitable to be prescribed? And finally, on the caseload trend, just now you mentioned that we can't just look at 1 or 2 days worth of case numbers. According to the CHP assessment, are we no longer in a plateau phase? And how can you describe this downward trend? Well, is that because a lot of people are reluctant to declare their positive results online? Let me first talk about the 3-year-old girl. And she had a brain condition and required constant care. On the 18th of March, and she had a seizure and fever and sent to the A department. And she was tested positive by RHE. She was found to be a terrible condition that in her a seizure during the ambulance and the AED, the medications failed to stop her seizure, and therefore she needed to be intubated and put under analgesia. And finally, she was put into the ICU and she was transferred to the general ward on the 25th. She deteriorated and passed away on the same day afternoon at 5:33 p.m. I believe that she was not found to be positive earlier. And for the mortality at the residential homes, For the residential homes residents, there are 3,786. Well, of course, this may not tally with Dr. Lee's figures. For some of the more recent death cases, we need to look at the type of the residential homes, and we will adjust later. And for the residential homes for the elderly, and the total death at the fifth wave, they're currently about 36,000 infected cases, made up of about 48% of the total number of RCHE residents. The 52% of the residents are not infected yet. For the residential home for the disabled, the latest figure is around 9,300 residents infected in this current wave, accounted for about 50% of the total RCHD population. Roughly about half of the RCHD residents are not infected. At this stage, we hope to boost the vaccination rates of care home residents in case of future rebound of another wave. They would be given adequate protection. Another question on the caseload trend. For the past 2 days, we noticed signs of stabilizations. We need to monitor a few more days to see if the caseload stay at a level or decline steadily. Looking at the figures over the past 3 weeks, the epidemic situations are showing signs of declining from the early March of over 70,000 per day and to about 50,000, and for the past 2 weeks at around 10 to 20,000 per day. Even though we're seeing a drop in actual number of cases, our assessment is that we are coming down from an extremely high level to a very high level. The current caseload of about 10,000, I would still say as still very critical. For the previous 2 waves and the third and the fourth wave, the maximum caseloads were around 100 plus, and that was the peak back then. And now we have under 10,000. This level is very high, and the epidemic is still very critical. The public should not be mistaken that we are putting things under control. We should not let down our guard. If you're showing symptoms, you should not mistake it as something else. Therefore, you should test as soon as possible. Well, we'll look out for the coming week to see there is a steady declining trend. I would like to supplement on the oral COVID drug. For a 3-year-old, it may be difficult to administer oral medications. Well, for the Paxlovid, for below 12 and the weight under 40 kg, we will not be able to prescribe it for those persons. Speaker on the mic. For the death case of care home residents, 17 from the RCHDs and the rest are from the RCHEs. And this is normal since the RCHE residents tend to be older, and the older it gets, the risk of death is higher as well. Last question. HK01. I would like to clarify on the death figures. Just now you talked about 139, and with the death in the hospital in 24 hours, there are about 114. There are 21 lagging deaths, and the 5 deaths in the morgues, altogether 140. Have we detected the Bretonji case? So that today death figure should be 140. Well, from the over 200, now we are around 140. In terms of reducing deaths, are we seeing results? By introducing the oral medication, do you think it's been conducive to reducing deaths? And now you see people queuing up to buy certain things. Are you worried that would it lead to a rebound? And for the CTNs, it has been reactivated for the past few days. In identifying positive cases, what is the situation? Will it affect the testing capacity? Would you step up for the CTN compared to the LTD? What is the criteria for deciding on which option? For the death cases, 114 plus 21 altogether be 135. Well, for the 14th of March, there was a death case we double counted, and therefore we need to deduct that accordingly. I believe that the Dr. L has removed that. Therefore, there are 5 cases from the mortuary. I'll see if Dr. L can supplement. For the death cases, we always attach great importance to them, and we try our utmost to save the patients. And what's the reason contributing to the lower number of deaths? We're not sure. And just now, Dr. L said that we see that we may have to do that there is some lagging between the epidemic situation and the death rate.
有關死亡數字
In relation to death cases, there are 6,888 cases compared to the figure announced yesterday. There was an addition of 139 cases. But as Dr. Lee said, it's actually increased by 140, but one case was taken off because it was reported previously. We see a decreasing trend in terms of death cases, but compared to the overall number of cases, we have not seen any significant drop. We'll continue to monitor the situation. As I've said previously, when someone is infected, perhaps it will be another week or two before that person passes away. So we're talking about maybe 2 weeks ago when that person was actually infected. So in terms of the trend of death cases, there may be a lag of 1 to 2 weeks, but the focus of the government is to reduce serious cases, number of deaths, as well as infections. And numerous measures have been put in place. We thank the central authorities for the assistance given. We've started to see a number of death cases stabilizing. We hope that the various social distancing measures and large-scale testings will be able to pick out all infected cases so that we can achieve the objective of early identification, early treatment, and isolation. We make use of the increasing capacity of PCR testing to increase the number of tests done. So people who live in high-risk buildings will be able to get the tests early. As to when we do CTNs or RTDs, currently for RTDs, we rely on sewage surveillance program results. We see that the results are quite accurate, as shown in the past month or two. Well, for buildings with the highest viral load in their sewage, we tend to identify quite a number of cases in these buildings. However, RTDs involve a lot of manpower. It cannot be done every single day. The other measure we have is CTN. Through our case reporting system, we can identify buildings with a higher number of cases, which is a sign that there is a transmission. Through CTNs, we will be able to alert residents so that they get tested for early identification. That's the end of the press conference. Thank you.